Okay, we have a beautiful female in her 20s who just got finished with her double upper eyelid surgery. Just wanted to talk about your experience. How was it for you?
Uh, it was very comfortable and easy, I would say. I don't really have much pain or swelling, even though I just got it done like moments ago. And the experience was overall very pleasant and comfortable. The staff and doctor, they made it easy for me. So I'd really recommend it. And previously, the procedure I'd done, one side came undone after 5 years, so this is my second time getting them both corrected. And I feel pretty comfortable, so I'd recommend it. This procedure, getting it done here.
Okay, well, thank you for coming. Thank you for sharing your experience with us. We'll follow you closely and hopefully we'll see you back soon, okay?
Thank you.
Okay, we have a Friday special. We have a beautiful 27-year-old Asian female who actually underwent initially a suture technique, double eyelid crease formation back in Korea, roughly about 7 years ago.
Yes.
What was your experience like at that time?
It was fine. It held up for like 6 years, and one side came undone about a year ago.
Yeah, so that's the reason why it prompted you, the fact that one side kind of unraveled itself and made you look asymmetric, it sort of prompted you to maybe consider having it done again, right?
Yes, that's correct.
So we recently saw you, and let's go ahead and focus onto that eye. Which eye would you say held up better, and which eye would you say became more unraveled?
This side was all right, and this side was completely undone.
Okay, so probably you noticed that it was completely undone about a year ago, but it probably began to happen very, very slowly over a course of a few years. Okay, but so upon analysis, you can clearly see that even with a fold, very natural, you don't really see a crease, but there's still a formation of a fold from the first surgery. Her eyes look slightly bigger, and this is pretty much unraveled, so the eye looks quite small. So overall, compared to the entire face, she felt as though her eye could appear optically a little bit larger with the newer, better crease formation. And that's exactly what we did. About a week ago, we did, this time, we did an open procedure. Go ahead and close your eyes. You can see the suture. Very, very fine sutures. We haven't removed it yet. We're going to be removing it in a few minutes now. Open your eyes again. There's a very, very nice, smooth transition, a very nice, smooth tucking in transition as she opens her eyes. Very natural looking. And I can't take all the credit, but she has really, really nice fundamental foundation. So we were able to achieve almost a perfect symmetry. This is not always the case. And all it takes is a little bit more swelling and a little bit more inherent asymmetry to make the eyes look very different left and right at this junction, which is exactly 1 week. But in her case, because I guess I got the symmetry down a little bit on her with a little bit of swelling and the foundation being so good, she looks really, really, really even, okay? Whereas here, you can clearly see there's the bigger eye and there's a smaller eye. So she's doing really, really well. Now, just tell me what your experience was like. You were telling me that you did all the things where you weren't supposed to. Go ahead and tell me.
So right after the surgery went great, very easy. And right afterwards, I went out to eat across the street, and then I walked around for about like a mile, and then I went home and resumed my regular activities. And after the third day, swelling went down and continued to go down, and this is a week later, so I'm very satisfied.
So because you've had surgery done 2 times, one was a closed technique via the suture technique, and this was an open technique. I think one of the advantages of the suture technique is, especially like when you were visiting Korea, you had a lot of plans. You had a lot of plans in your itinerary, and you're moving on about, right? And that was what was great about suture technique.
Right.
Would you say that this open technique kept you down at home, bogged down with no activities, really compared to the suture technique?
No, not really.
Not really.
Not really.
Okay.
Both of them are, it is a surgery, but both of them are, to me personally, it was about the same. I would
Yeah,
say.
and even the degree of the swelling. How would you comment on the degree of the swelling between the 2 different techniques?
Really minimal.
Yeah.
I was very satisfied with this.
Yeah, so the bottom line is if the open technique is done meticulously and carefully with minimal bruising, I mean there's obviously some bruising here, but minimal bruising and minimal swelling, the recovery period, especially during the critical first week, is really almost the same, which is to say, as long as you don't do anything strenuous and you're careful to keep your head up for about 3 days and use ice for the first 3 days only, you're not going to be kept down. You should be able to pretty much do everything you can do. Now you're a law school student, so you have to study all the time. When did you get back and hit your books again?
Like the same day. I was
Okay.
watching movies and studying the same day.
Yeah, so you pretty much resumed your activity pretty much right away. Right, that's good. All right, so this is exactly 1 week out. So for the people out there who are afraid that they're gonna swell up like crazy and prevent you from doing all your regular activities, sometimes we do have patients with a lot of bruising, a lot of swelling. It's not surgery is not a perfect science, but most of the times we have a situation where patients can pretty much do everything they want to, and within reason, of course, right? So, good. And what was the degree of the pain that you had in the last week or so?
I had no pain. It was just
Yeah.
itchy today.
Yeah, you're itching to have those sutures
Mhm,
removed.
Yes.
So you look great,
Thank you.
and yeah, we're gonna take all these sutures out today, and we'll follow you like every 2 weeks until you look perfect. And you're almost getting there now.
Excellent.
And thank you for sharing this video with others out there. Thank you. All right.
Bye.